My name is Valerie Lamb. I am with the Colorado Chinese Medicine University. I will be talking to you today about post-COVID syndrome, and I will be sharing my screen with you right now. My presentation today will be on the effects of Chinese medicine on long-term COVID-19 sequelae or post-COVID syndrome, PCS, a retrospective study. The introduction will cover post-COVID syndrome, PCS, the pathophysiology, treatment and management, signs and symptoms, the impact of long COVID, current research done on post-COVID, and also post-COVID syndrome and Chinese medicine. So all of these estimated numbers of cases are conservative because of the asymptomatic patients, misdiagnoses, and etc. So there have been at least 689 million confirmed COVID cases, with 6.9 million COVID-related deaths. There's estimated percentage of survivors that have long COVID, and that varies among patients, but there have been anywhere from 10 to 30% that have been non-hospitalized, 50 to 70%, or as high as 85% that were hospitalized, and 10 to 12% vaccinated. So COVID-19 sequelae is defined as persistent physical, medical, and cognitive conditions resulting from infection of SARS-CoV-2 virus in absence of any other alternate diagnosis. So it's typically diagnosed as long COVID if it's been 4 to 12 weeks. Anything beyond 12 weeks is already post-COVID syndrome. So of the 689 million confirmed COVID cases, there have been the 66.9 million COVID-related deaths, and also the survivors. Among the survivors, they are divided into 3 different groups. One group made full recovery. One group is at long COVID, which is 4 to 12 weeks. And then there's the patients who are diagnosed with PCS, which they have had symptoms for more than 12 weeks. This is just a chart from WHO that shows the distribution of reported COVID-19 cases. So PCS includes a wide varying scope of symptoms that span multiple systems. So this can include immune dysregulation, which pulmonary embolism, diabetes type 2, microclots, organ damage. There are also newly onset type 1 diabetes in children, along with fatigue, headache, dizziness, insomnia. There's also neurological, cognitive, autonomic, sensory, and systemic symptoms, dysautonomia and associated symptoms, which basically dysfunction of the autonomic nervous system, including changes in heart rate and blood pressure, so POTS, hypertension, reproductive system symptoms, respiratory system, gastrointestinal system, endocrine system, and other miscellaneous symptoms. The exact pathophysiology of PCS is still unknown. Potential pathophysiological mechanisms include virus-specific damage, which can include viral targeting of neural tissue, and that results in persistent inflammation, causes change in body temperature, blood pressure, heart rate, GI, in energy, and also myalgia. Abnormalities in immunological response, hyperinflammation, microvascular thrombosis, autoimmune and autoantibodies, the viral reservoirs, and also molecular mimicry, which essentially means when there's proteolytic destruction of the SARS-CoV-2 virus, it produces peptide fragments that mimic antimicrobial peptides and attach to host cells. These are just some studies of some possible pathophysiological mechanisms of that cause long COVID and PCS. So there's no one specific treatment for PCS, but these are just methods in how the symptoms are being managed. Some challenges in managing long COVID include include having no correlation because it affects adults and children alike. There's no indication but there seem to be some indication with low to no SARS-CoV-2 antibody protection, low or absent CD4 plus or CD8 plus T cell responses levels and functions, and there are other insufficient immune responses that can be predictive of long COVID. There's no standardized list of PCS symptoms or consistent risk factors, so there's no single effective treatment due to the diverse range of symptoms. These are just a list of the more commonly used medications that are prescribed. And they mostly are to help with lung fibrosis, brain fog, fatigue, breathing dysfunction, and microvascular clotting. Some of the more prevalent PCS signs and symptoms include fatigue, general malaise and weakness, myalgia, arthralgia, headaches, dyspnea, cough, loss of or dysfunction of smell and or taste, and neurocognitive symptoms. So the ones that definitely are most persistent include fatigue, post-exertional malaise, cognitive dysfunction, and these are usually persisting beyond 6 months. So these are a compiled list of all the signs and symptoms that were mentioned in current research and literature. The ones with the percentage beside them are the symptoms that are mentioned the most often. So the impact of long COVID includes a decline in quality of life. A lot of activities people aren't able to do anymore because of the dysfunction in breathing and also energy levels. Decreased workability, that also impacts earnings and causes economic instability. Increased sick leave, increased family leave, and increase in mental health problems, as well as increases healthcare costs. So this is just some of the more current research that has been done on the prevalence of PCS in the world right now. So it ranges anywhere from 1 to 10. In Davis et al., it's 1 in 7 COVID-19 patients are still symptomatic at 12 weeks. And again, the fatigue, post-exertional malaise, and cognitive dysfunction are the symptoms that persist beyond 12 months. Loy et al., 2022, 1 in 5 COVID-19 patients are still symptomatic at 5 weeks, and 1 in 10 COVID-19 patients may have symptoms lasting 12 weeks or longer. Acupuncture 2021, and there's an overall reduction in the quality of life in the online survey that quality of life, lower scores regarding general health, mental and physical health, and reduction in social and physical activities. So for PCS in Chinese medicine, there have been some common TCM patterns that occur, like lung qi deficiency, spleen qi deficiency, yin deficiency, qi deficiency, yang deficiency. And again, this is just a chart of some of the studies done on PCS and Chinese medicine. So in the first study, which is a meta-analysis, they took a look at acupuncture and Chinese herbal medicine in treatment of PCS, and they did find favorable treatment outcomes as well as improved quality of life. In the following 2 research studies, they were specific case studies. The 50-year-old female patient, ongoing 8 months of fatigue, anosmia, chest pressure, palpitations, pericardial effusion, thyroid issues, and increased D-dimers. In 7 sessions over a 9-week period, concurrent with PT, she made full recovery and was able to resume normal exercise. In Hollifield et al., a 46-year-old male diagnosed with COVID-19 in July of 2020 has a history of asthma and PTSD, was experiencing cough, headaches, pain in the fingers, and joint pain. In a treatment period from February to June of 2021, there was an overall improvement of symptoms. So for the methodology, this was a retrospective observational study. When I was designing the study, I was using electronic health records obtained from Colorado Chinese Medicine University. Some limitations definitely included inconsistency in the common data elements. So for the study design, out of 1,244 total initial entries, there were only 145 entries associated with COVID. Of those 145 entries, there were 142 relevant entries and 3 irrelevant entries. So of the 142 relevant entries, there was 3 subsets again there. The first one is that the chief complaint was related to long COVID, so that was 40. There were 40 of those. One was positive COVID infection, but not the chief complaint. And then there were also long COVID symptoms mentioned elsewhere in the intake. So part of the problem with part of the limitations was that of the 142 entries, there was no consistent language across the entries, and so the data sorting part of things was a little bit tricky using AI. So for the results, though, these were the chief complaints symptoms. These were the symptoms that were mentioned in all of the 142 intakes, along with the frequency that these symptoms were mentioned. And these were the classical Chinese medicine diagnoses that were found from the data set, along with the frequencies there as well. In addition to the difference in vocabulary, some other limitations included lack of longitudinal follow-ups, especially with anonymous data. It was different intake forms. It was just inconsistent. So these were the symptoms and the diagnoses were the most consistent factors in this data set. So for the conclusions, the retrospective study, the most prevalent or common symptoms from the data set did match the symptoms from the literature list. Results on the efficacy of Chinese medicine as an adjunctive treatment were inconclusive, again, because the results of the data set were very scattered. But and it was also different because most of the research that was done with PCS and TCM were using traditional Chinese medicine diagnoses, whereas this data set was focusing more on the common classical Chinese medicine diagnoses and treatments. Complaints of COVID vaccines, there were also complaints of COVID vaccines causing ill effects. Literature review, there were mixed and different impacts of COVID-19 vaccines, but there did indicate a positive trend with Chinese medicine treatment. So some discussion, obstacles with studies in Chinese medicine is lack of consistency in the common data elements. Each practitioner has different diagnostic methods. The charting language was inconsistent. There was no there was a lack of consistent outcome measures, as well as lack of longitudinal follow-ups. So to improve future studies, we need larger sample populations for more large-scale studies. And if anybody would like more information, please contact the administrator. I will be unsharing my screen now. Thank you very much for taking time to listen to my presentation. Have a good day.